Good morning, everyone. I hope you are doing well. Today is October the 14th, 2021, and I have been attempting to discuss some mental health issues that a lot of people have and they get diagnosed with, but they don't necessarily understand it or know what it's about, or maybe they don't get diagnosed with it, but they know that they have it or suspect that they have it. Recently, I had a client ask me to do a video on disassociation, and I will admit it is not a topic that I have been very knowledgeable about because it's not something that you see very often. So I did some research on it, and I found some interesting facts about it, and none of this stuff is original. None of it I wrote or came up with, and I will be crediting links in my video the sites where I got this information. So first of all, I want to discuss what is disassociation and why does it happen. Well, according to the goodtherapy.org website, it says that it occurs when someone disconnects from some part of himself or herself or the environment. It can occur in a number of different ways, including disconnection from one's emotions, body, sensation, memories, senses, and other things. What causes disassociation? The exact cause of disassociation is unclear, but it often affects people who have experienced a life-threatening or traumatic event, such as extreme violence, war, kidnapping, childhood abuse. In these cases, it's a natural reaction to feelings about experiences that the individual cannot control. The way I take it is a coping mechanism of the brain where it just shuts down or becomes somebody else temporarily so that you don't have to deal with the traumatic events or remember what is going on or what has happened in your life. This is according to medicalnewstoday.com. What triggers disassociation? According to safesupportivelearning.ed.gov, triggers are sensory stimuli connected with a person's trauma, and disassociation is an overload response even years after the traumatic event or circumstances have ceased. Certain sights, sound, smells, touches, and even tastes can set off or trigger a cascade of unwanted memories or feelings. Our senses are connected to so many things and everything that we do. And I know for myself, I can hear a song, I can smell something, I can taste something or touch something, and it'll take me right back to what I was doing when I first heard the song. Or it might be something that my grandmother used to make, and I will smell it or eat it, and I'll be reminded of her and being at her house and the security that I felt and the safeness that I felt of being there. So our senses play a lot into everything that happens to us and everything that we do. Some people are triggered by sounds. It might be hearing a clicking noise if they have been around somebody or somewhere that there has been gunfire. It can be a slamming door if they have lived in a violent or volatile situation. It can be anything that they could remember from any of the five senses that was going on at the time that it happened. How do I know if I'm disassociating? According to the Mayo Clinic, signs and symptoms depend on the type of dissociative disorders you have. Many include memory loss, amnesia of certain time periods, events, people, and personal information, a sense of being detached from yourself and your emotions, a perception of the people and things around you as distorted and unreal. Is it normal to disassociate? According to psychiatry.org, disassociation is a disconnect between a person's thoughts, memories, feelings, actions, or sense of who he or she is. This is a normal process that everyone has experienced. So I want to talk now about the symptoms of dissociation, and this comes from a website that I have been looking at called traumaassociation.com. Dissociative disorders are mutually exclusive and appear in hierarchy with dissociative identity disorder taking precedence over dissociative amnesia and depersonalization, derealization disorder, dissociative disorder, not otherwise specified. Multiple personality disorder became a separate diagnosis rather than a subtype of a more general condition. Multiple personality disorder was renamed dissociative identity disorder in the 1994 DSM-4. It's very hard to detect dissociative personality disorder. It's not as common as you think, and it's very hard to identify. And you have to work with the person for a very long time in order to see these other personalities manifest. Dissociative disorders of movement or sensation. Dissociative amnesia and sensory loss and dissociative motor disorder are all recognized in the DSM-5, which is the diagnostic and statistical manual of disorders that therapists, doctors, psychologists, psychiatrists diagnose from. When you go in and you start telling them your symptoms, they will reference the DSM-5 and what most of your symptoms fit into. The diagnosis that most of your symptoms fit into is the diagnosis that you normally get. Bear in mind that many symptoms of different diagnoses cross over, and that's why you have to cross-reference and check and make sure that you're not misdiagnosing. And sometimes down the road, after working with a client for a while, you will realize that you're seeing the manifestation of a different diagnosis than your original one, which I think is very difficult. The insurance companies require that you have a valid billable diagnosis to get payment for the services that you provide, and it's really hard to meet with somebody one time and know exactly what their diagnosis is. So I have experienced that down the road I will find that the diagnosis is changed, and I'll go in and note that based on what the client is exhibiting, that the diagnosis appears to be whatever diagnosis that they are. Amnesia is a recurrent memory problem, often described as losing time, and these gaps in memory can vary from several minutes to years. Depersonalization is a sense of detachment or disconnection from oneself. This can include feeling like a stranger to yourself, feeling detached from your emotions, feeling robotic or like you are on autopilot, or feeling like a part of your body does not belong to you. Some people self-injure when depersonalized, for example, in order to feel real. I have heard people tell me that they have cut themselves or burned themselves or harmed themselves so that they can feel the pain, the physical pain on the outside of their body, instead of having to feel the inner pain of their emotions and the trauma. Derealization is a sense of disconnection from familiar people or one's surroundings. For example, close relatives or your own home may seem unreal or foreign. Episodes of derealization may happen during flashbacks. This often occurs when somebody has PTSD, such as being in war, being in a bad or abusive relationship, child abuse, any rape, car wreck, car accident, any traumatic thing that takes you back and hooks you back into reliving those memories, flashbacks, night terrors, nightmares, triggers such as you smell, see, or hear something, and it will trigger you. May happen, and you suddenly feel much younger and feel your present environment is unreal during this time. Identity confusion, an inner struggle about one's sense of self-identity, which may involve uncertainty, puzzlement, or conflict. Severe identity confusion regarding sexual identity has been reported in people who have been sexually abused. Identity alteration, a sense of acting like a different person. Some of the time, recognizable signs of identity alteration include using of different names in different situations, discovering you have items you don't recognize, or having a learned skill which you have no recollection of learning. Mild identity alteration is widespread in the non-clinical population and does not cause difficulties for the person. For example, a person assumes a different role but remain aware of his alteration. Mood or behavior changes which don't feel under your control but don't involve using different names or changes in memory or perceived age. Indicate moderate identity alteration. This is common in non-dissociative disorders, for example, in borderline personality disorder. Typically, it is your borderline personality disorder people who are going to be cutting or harming themselves. That is the one thing that can help you identify that you may be dealing with someone with borderline personality disorder if they tell you that they are cutting or have been cutting or feel like cutting, they want to cut, they've done it in the past. Sometimes people do it, but they'll stop. And you see this a lot when teenagers become adults, and as they get into their late 20s and begin getting older, they won't do it as much. They may try it for a while and then not do it anymore. People with borderline personality disorder are usually very inconsistent. They bounce around a lot. It's not uncommon to see them bounce from different relationships, different jobs, living where they're at. They typically keep a lot of chaotic drama going on around them because that is the environment that they're most comfortable in. They want stability. They want lasting relationships. They want to be able to hold down a steady job, but they can't because they thrive in a chaotic environment. And a lot of times you will look back at their history and what happened to them growing up and the trauma that they've experienced, and that comes from living in that chaotic environment. We tend to go back to what we feel comfortable with, even if we know it's not good for us, because the devil that we know is scarier than the one that's out there that may be worse than what we've experienced, but it also may be better. But fear keeps us stuck in that same old familiar role. You will see people grow up in an environment where there's drug use, alcohol use, and many times they will be doing the same thing because that's what they learned. You learn what you're modeled. If you grow up in an environment where there's a lot of anxiety, where there's a lot of depression, chances are you're going to follow in the footsteps of your family. Some people don't know in their family history if they have a history of any mental disorders, but a lot of people do, and they can tell you, yes, my mother, my father, brother, aunt, whoever has been diagnosed with bipolar disorder, depressive disorder, anxiety disorder. And you'll see that genetics plays a lot into the passing on of these mental disorders, and environment. It is very much nature versus nurture. It's some of each, and we are a product of our environment. We can learn and grow and change. We can't change where we came from. We typically can't change our personality, because our personality we're born with. So when you hear that somebody's been diagnosed with a personality disorder, understand that that is something that will never change. They may be able to take medication and do better with it, handle it better, keep it under control from learning about it, but you cannot change your personality. Now, a mood disorder such as depression, anxiety, that comes from chemical imbalances in the brain, and you can control that with medication. You can build your serotonin levels in your brain by getting out in the sun. If you tend to be depressed, then get out in the sun for 10 minutes every day, because when you're in the sun, you build up the serotonin levels in your brain, and serotonin is the chemical that that gets depleted, and that is what the antidepressant, the SSRIs, they are called serotonin reuptake inhibitors, and they build the serotonin in your brain with medication, but you can also do that by getting in the sun for a few minutes every day. This is why on gloomy days, if it's rainy or cloudy, you might feel a little bit down or sad or blue, probably because the serotonin levels in your brain have dropped. So I hope that something in this was informative. I hope it was helpful. I hope that you got something out of it. I hope that you will come back, that you'll subscribe and share, and leave a comment below. If there's something that you want information on, I will be happy to look into it and do videos on it. I'm all about education. I do believe that knowledge is power, and that with the more we know, the more we can see, and the more we can handle things and resolve things and take care of things in our life if we are knowledgeable about it. If you go to the doctor and they say, well, you have diabetes, you have high blood pressure, you have heart disease, and if you don't go on this medication, you may have a heart attack, or you could have a stroke, or your body may produce too much insulin. And diabetes is not a disorder, disease that you need to play around with, because it can really take a toll on your body. All of them can, but diabetes it affects your sight, your hearing, your digestion, everything. Neuropathy, numbness, tingling in the extremities, the feet and legs, hands, fingers. So you wouldn't think twice about going on a medication for anything like that, a physical disorder. But a lot of people still have that negative stigma about going on a medication to help stabilize their mood. Well, you can't control the chemicals in your brain any more than you can control your high blood pressure and heart disease or insulin. I mean, yes, to a certain degree, you can control it with diet and exercise and healthy living, but overall, you're probably going to need medication. And if that medication is going to help prolong your life or keep you alive, you're not going to think twice about going on it. Well, everything starts in our brain. Without the thought, there can't be a behavior. Why would you not want mental clarity? And why would you not be willing to take a medication to level out the chemicals in your brain? I don't understand that, but it is what it is. But I'm Dot, and I hope that in some way I have helped you connect the dots. Talk to you soon.